Butcher, and I pay our respects to elders past, present, and emerging, acknowledging this land was never ceded, it's stolen land, and we have a lot of unfinished business. And I'm sure, like Wacos, you are committed to addressing that unfinished business. I'd also like to note that we're in the season of Baru, which is supposed to be the hottest season of the year. It was hot in February. It goes from February to March. It was hot then, but I'm thankful that it's cooling down a little bit. It's the season where we see a lot of flowering trees. It's the season where the Noongar people used to go to the coast because that's when the fish were running. And so they'd move to take advantage of the seafood along coastal areas, which is one of the many reasons why we also need to be protecting our fishing areas because of the importance that our ocean areas played in the diet for First Nations peoples. Just going to do a little bit of housekeeping before I throw over to others to speak, and that is please keep yourself muted. We will be having a bit of a Q&A at the end. If you have questions, feel free to put it into the chat as we're going along, because if you're like me, sometimes you forget your question when you hear the next person. So feel free to put it in the chat and we will try to get to them as many as we can. I'm really very excited that we're joined by three wonderful guests. We've got Quinton Beresford, Danielle Vecchio, and our own Rose Newby-Freeman. During this session, we're going to be exploring the political, regulatory, and industry forces shaping Australia's gambling environment, emerging harms affecting young people through gaming and digital platforms, opportunities for prevention, early action, improved responses and reforms, and key findings and recommendations from the scoping study that we are releasing today. So first, let me introduce Dr. Quinton Beresford. We're really excited and pleased to have Quinton join us today. He's a political scientist and author of Hooked: Inside the Murky World of Australia's Gambling Industry. He is a multi-award-winning non-fiction writer on a wide range of issues, from environmental disasters to political corruption to Aboriginal First Nations people's rights. Quinton, I'm going to hand over to you and silence my phone so it doesn't ping again. Over to you, Quinton.
Thanks, Rachel, and thank you, everybody, Rose included, for inviting me. It's a great privilege to be here at your very important occasion. Now, look, let me start up front with the statistic that should be front and centre in any debate about gambling in Australia, and that's the one in front of you, the per head losses in Australia, which rank as the highest in the world. I mean, that is obviously a shameful statistic, but one in which any discussion on gambling policy has to grapple with. Now, when you look at the monetary figures behind that world ranking losses represent 32 billion annual losses incurred by Australians. If you break that down, it's about $1,500 per head. But if you extract roughly 50% of the population that gamble not at all or very irregularly, those individual losses would probably double. So this is a shameful statistic. Among the 50% of people who gamble regularly in Australia, it is thought up to 20% will become problem gamblers, and that they will affect 1 in 6 other people in terms of direct impacts from the gambling losses. Next slide. Thanks, Rose. Are we good? Great. Look, here's the evolution historically, and if you look down at the bottom right-hand corner, in the early 80s, losses per head were quite small. Basically, all forms of gambling were restricted to horse racing and greyhound racing predominantly. Then in the early 80s, you get in the early 50s, you get the legalisation of poker machines in New South Wales, and they ramp up gambling losses in that state. Then Victoria in the mid 80s releases poker machines into the community. Then if you shift up the graph, you'll see there's another spike in the early 90s when the first big casinos come online, Jupiter in Queensland and then Crown in Melbourne. Keep going up, of course. In the early 90s, you get the mass release of poker machines into the community. Western Australia is an exception. We can talk about that. And then from the early 2000s, you get another spike around the onset of online gambling. Now, what I'd say is that that's a massive shift effectively within a generation. So you go from relatively low individual losses from gambling, that's not to downplay what was happening then, but relatively low in a total
It's
community
live and
sense,
I can't see them. I could, and then I did something.
to a massive upgrade in losses. And that reflects government policy. So let's have a look at how that government policy evolved over that period of time. Thanks, Rose. Okay. So basically, my argument in Hooked is that the gambling industry has overwhelmed government policy. It's captured government policy in the interests of the industry. And as I document in the book, that began in the 1950s with the legalisation of poker machines in New South Wales and the rise of the big leagues, clubs and RSL clubs stacked with hundreds and hundreds of poker machines. What happened is that those clubs attracted mass membership in the tens of thousands in each club. Clubs were strewn right around the western suburbs of Sydney and out into country towns. And their mass membership was used by those clubs to intimidate local politicians. So right from the onset of the deregulation of gambling in Australia, the industry found a way to capture politicians, and we saw that first and very onerously in New South Wales. So then in the 1980s, we get the arrival of the big casinos, as I mentioned, Jupiter and later Crown, and then of course in Tasmania, West Point. Now the casinos generated such enormous profits and became such important employers of people working in them, that they were a very significant power on governments. And the casino industry effectively capitulated the regulators, which enabled the casinos to pursue pretty predatory gambling model. Then in the 1990s, we have the mass release of poker machines into the community. Western Australia is the exception. Now, basically, all state governments other than Western Australia released in total 130,000 poker machines into the community. There are already about 70,000 in New South Wales. So Australia had roughly 200,000 poker machines spread across the community. The most important thing to say about that is that mass release of poker machines into the community had not occurred anywhere else in the world. Basically, in other parts of the world, poker machines were restricted to gambling-only areas. What happens in Australia is that hotels become mini casinos through the installation of poker machines, and football clubs developed a business model really reliant on the installation of poker machines into AFL clubs and RNL clubs. So this penetrated gambling into the community at an extraordinary level, with Australia's poker machines being the most high intensity in the world. That is, the losses per machine were higher than anywhere else in the world. You could lose in Australia $1,200 an hour playing poker machines. Now, the claim that Western Australia didn't follow this model is important, because it was often claimed that gambling problems in Western Australia are about a third less because the state didn't follow that model of mass release of poker machines into the community. I would question now how valid that argument is given the ubiquity of online gambling. So I'll just make that point and we can come back to that later on. So from 2007, you get the advent of mass promotion of online gambling. It's built around, of course, smartphones. The first smartphones come out in 2007. The industry is based in the Northern Territory, where there's very few regulations. And we had about 30 big international and national gambling companies set up an online business through Northern Territory, where they were basically unregulated. And as we know, the online industry takes over our major sporting codes and captures the media through mass advertising. And what we get out of that is two things: the gamblification of sport, that is, the normalisation of gambling taking place around sport, and through that, the broad social acceptance of gambling in the community, and particularly the socialisation of children into gambling as a result of mass advertising on television and social media. Thanks, Rose. The next one. Now, as I said, governments have been willing partners in this industrialisation of gambling in Australia, and there have been a few reasons for it. Firstly, state governments, right from the 1950s, realised the revenue potential around taxing poker machines in particular. And I think the really unfortunate aspect of that is that when you look at the abolition of death duties in Australian state governments from the 1970s and 1980s, revenue had to be found to replace the loss of that revenue. And of course, estate duties hit the rich the hardest, of course. And the abolition of those left a big hole in state government budgets. And this really, there was no direct correlation here, but basically state governments came to rely on gambling taxes to replace that revenue. So we went from a taxation system at the state level, where the wealthy paid a fair share of their wealth to state government budgets, shifting to gambling taxes, which hit the poorest, the less well off, the hardest. So there's been an injustice in the way that state government budgets have been constructed, relying around gambling taxes. Now, it's said somewhere between 7 and 10% of state government budgets rely on gambling taxes. Now, of course, the gambling industry, to protect its business model, became heavy donors to political parties. There's evidence to suggest that the gambling industry is one of the biggest donors to political parties in Australia. Millions, tens of millions of dollars, and there's probably a lot of dark money that flows in from the gambling industry as well. And that meant the gambling industry is a very lucrative area for politicians to leave politics and go into gambling industry corporate jobs. There's been numerous of them over the years, politicians that have taken up jobs in the gambling industry. So you get this symbiosis in the system between the industry and the political system. And as a consequence of both the heavy donations and the symbiotic relationship between the gambling industry and politics, basically governments become intimidated by the power of the gambling industry. Next slide. Thanks, Rose. And we saw this play out in a very dramatic way in 2011 when newly elected independent member in Tasmania, Andrew Wilkie, did a deal with Prime Minister Julia Gillard, who got elected 2011 in a minority government situation. Wilkie came along and said, "I'll be one of the independents that supports your government if you proceed with gambling reform." And Wilkie had two measures in mind: $1 minimum bets for poker machines and mandatory pre-commitment for poker machines. That is, gamblers would have a smart card on which they would place their maximum amount of losses. After that, of course, the card would render the poker machine inoperable for them. Now, what's extraordinary is really two things. Firstly, the two measures that Wilkie proposed, worthwhile as they were very modest reforms. There was nothing earth-shaking to the industry really about these two reforms, yet they unleashed the fiercest backlash from the gambling industry and its associated business partners that the country's ever seen. So when you look down that list, who came on board to try and knock off Wilkie's reforms? James Packer, of course, owner of Crown Resorts, the Hotels Association, because hotels had now stacked their premises with poker machines, and billionaires had arisen out of the relationship between hotels and poker machines. The big sporting football clubs got on board to try and knock this off. Clubs Australia, that is the big leagues clubs and RSL clubs. Woolworths strangely emerged as one of the largest owners of poker machines in the country. Channel 9, of course, relied on TV advertising, and together, either as silent partners or overt campaigners, they raised $40 million to knock off these modest reforms. They developed a media campaign saying that Wilkie was creating a licence to punt in Australia, and that was un-Australian. And it was a very, very powerful, emotive campaign to the suburbs and country towns of Australia. And they supplemented that with a marginal seat campaign targeting politicians whose seats were vulnerable in the upcoming election. Now, this had a chill effect because Gillard infamously dropped the deal with Wilkie. She wouldn't go ahead with it. She flew down to Tasmania and said, this is now off. And basically she was responding to the politics of it, that the industry had just unleashed this overwhelmingly powerful campaign to intimidate politicians and knock them off. Now, we haven't had any serious reform at the federal level to the gambling industry since then. That tells you something. At the state government level, we've had 2 state premiers attempt to reform the gambling industry, in Tasmania in 2018 and in New South Wales under Dominic Perrottet a few years ago. Both lost, and the gambling industry unleashed further campaigns to knock off the modest reforms at the state level as well. Next slide. Thanks, Rose. So what we've got is a gambling industry in Australia that is all-powerful. I would argue it's probably one of, if not the most powerful lobby in Canberra and in the corridors of state parliaments. Probably equal to, if not surpassing, the mining industry. And of course, we know in Australia, the mining industry gets pretty much all at once. So in Australia, the gambling industry has built up a fearsome reputation for protecting its interests. Now, I don't want to suggest that that means that there's little chance of reform occurring. I think the reverse is true. We now sit really on the cusp of being able to push through for major reform. And let me go through how I think that happens. So many of you would have heard of the Murphy inquiry, the inquiry established in 2022 by Labor backbencher Peter Murphy, which came up with a far-reaching report into online gambling. It didn't look at other forms of gambling, but it created a very worthwhile and far-reaching blueprint for reform. And the terrible plight of that reform was that Albanese, in the lead up to the last federal election, walked away from it, dropped the major recommendations. The prime one, of course, was banning gambling ads. Now, but Albanese walked away from it. It was just too difficult politically for him, he judged. But when you look at the residual support for reform, it's considerable. There is widespread community concern that the gambling industry is out of control. Parents are especially worried about the infiltration of gambling ads through mainstream and social media. And polls show there's about 70% support for a ban. There's a very sophisticated non-government organisation campaign. Of course, WACOS is part of that campaign. For those that aren't aware of it, the Alliance for Gambling Reform, the organisation headed by Tim Costello, who's had decades of activism in the space of gambling reforms, very sophisticated, and influential non-government organisation pressing for reform. We've got a network of gambling researchers around the country that do extremely important work that gets quite a lot of publicity. And when you look at the hard politics of it, the Greens and Independents back reform. They just, at the moment, aren't in a majority situation where they can push anything through, but that will potentially change. And there's a lot of ongoing media interest in reform, particularly through the ABC and the Guardian newspaper and other venues as well. And there is a group of Labor backbenchers who press the need for reform within the party at the moment. They haven't been able to get legislation to the caucus, but again, that will change. So I guess what I'm saying is we've got to be aware of the scale of the challenge in front of us, because those of us who know how damaging this industry has become to the community know and are informed on the politics of this and the power that lies behind the gambling industry in Australia. But by the same token, although we have to be realistic, we have to take heart from what's going on. And what is going on is a continuing campaign to bring this industry under control. Those of us calling for reform are not anti-gambling. I mean, politicians, including Albanese, have called those calling for reform prohibitionists, which is just really a political tactic. What people who are concerned about the social impacts of this industry want is sensible reform to wind back the social devastation that this industry is causing out there in the community. Last slide, saying thanks, Rose. So I'd just like to acknowledge Wacos's report. Congratulations on getting the report together. As a writer in this field, I know how important it is for non-government agencies to continue to advocate in this area. As I said, there is significant ongoing social damage being perpetrated on the Australian population through an out-of-control gambling industry. Those of us who are parents and grandparents watching their kids silently, exposed to gambling industry adverts that effectively socialise them into how to gamble is a real problem. So thanks very much for the invitation to talk, and I hand you back to Rachel.
Thank you so much for that really good rundown of the current situation. And also add my apologies. I had a slight screen meltdown, which I was trying to get fixed in the background. So sorry, I forgot to turn off the mute. I'd now like to introduce Dr. Danielle Vecchio. She's the head of mental health and addiction services at Fiona Stanley Hospital. She is a pioneer in establishing the first publicly funded gaming disorder clinic in Australia in 2022. She is also the director of the Australian Gaming and Screens Alliance and is the 2026 West Australian of the Year. Daniela, I'm going to hand over to you. You're on mute. You have to say that during at least one webinar.
That's true. Thank you for inviting me. It is really a pleasure to be here, and thank you everyone for attending. So I'm Daniela Vecchio, psychiatrist and head of service, and also have the responsibility of being the 2026 WA Australian of the Year. Gaming disorder is a behavioral addiction. It means that people get addicted to playing video games online. And the key features of this addiction is continuing the use despite negative consequences, loss of control in terms of hours spent playing video games, and priority given to video games over other activities. The patients that we see in our clinic are across the lifespan, but mostly are teenagers, and more recently we have seen an increased number of referrals of very young people. The youngest is 5 years old. What do they have in common? They get very much isolated. They spend excessive amount of time in their room. They are very secretive about what they do online, who they connect to. They play many hours a day, and also at night they spend the time playing video games and on social media. And they get quite tired during the day. They start refusing to go to school. They don't look for employment. They don't look for training opportunities. These are the children who will become very much isolated and marginalized adults. They also develop mental health issues like depression, anxiety, physical health issues like being overweight, developing diabetes. And they have or they get in financial issues. They steal credit card, for example, from their parents to fund their online use. On occasions when there are limits posed to their gaming time, they get very aggressive. We have very significant cases of aggression of the child towards parent. The prevalence of gaming disorder is 3.3, the global prevalence. Some studies in Australia indicate that in teenagers is 2.8%. This means that in Australia at least 100,000 teenagers are already addicted to playing video games. I believe this is an underestimate because there are no screenings, so we don't really know the numbers, which are likely to be much higher. Some of the consequences of excessive screen use are also on the developing child. So there is now evidence that when the primary caregivers, they spend excessive amount of time online, this affects the attachment, but affects also the social development, the cognitive development, and the development of the language. So there are many cases of very young children who do not talk when this is the age that they should talk because of their parents' online use. I started the gaming disorder clinic in Fiona Stanley Hospital in 2022. This is the first and the only outpatient clinic in a public hospital in Australia. It receives from the hospital only funding for 0.1 psychiatrists. This means 4 hours a week. To make the clinic up and running, we have done regular teaching, we do upskilling, and we borrow resources. The clinic is statewide, led by psychiatry. We take referrals across the lifespan. Anyone can refer. We offer face-to-face, telehealth, and phone appointments. And we operate 7 days a week, over extended hours. We do early detection, assessment, and treatment. This means that it's unique in the world because the clinic is in a tertiary setting, but also people may present to the hospital due to a medical condition. And for example, we had a patient who presented because this was due to prolonged sitting for several years, and playing online video games for many hours during the day. So this patient presented to the hospital due to a physical health issue, and gaming disorder was contributing. We see patients in the clinic, but also, particularly when patients live in metro area, we see them at home, and some children refuse to come to us. So we work with the families, we see children in schools, we see children in local places like a local library. We offer a variety of interventions. These include detox from devices, but also we encourage social prescribing. So we prescribe social activities that these children can do with their parents. For example, without devices. So, for example, cooking and eating together, spending 2 hours together without the interference of a phone, of an electronic device. Gaming disorder usually comes associated with other conditions like anxiety, depression, and neurodevelopmental disorders, so we assess them as well. And we run a self-help group. So once a week, our patients come together and we engage them in talking with each other, but also in playing some tabletop games. And we have now partnership with an agency, Jobs and Skills. So this agency provides outreach, come to the clinic, and they talk about jobs opportunities, vocational opportunities. This is to stimulate the return, if you like, to school, to training. We also train health professionals nationally and internationally. Here I was in Dubai and I was training a few months ago the staff from that hospital in the recognition of gaming disorder. Some data from our clinic. We have seen 374 patients. Majority are males. You can see here across the age span, most are teenagers, age 15 to 19, followed by 10 to 14, but there is an increased number of very young children. Something very concerning for all of us, most of them, they do not attend school. They refuse to go to school. So they are isolated at home. But also employment. Most of them, they are not in employment. And majority of them, they are not in a relationship. They are single. You may know that Australia unfortunately scores very high for bullying in schools, but also that Australia has the problem of school refusal. This is a very important issue. And if we look at the data from Western Australia, only 58.1% of children regularly attend school. Why we are so attracted to games, to online platforms? The reason is that they are made to make us addicted. They are made in a way that we can spend as much time as possible online, but also we can spend as much money as possible online. And this is through an addictive design, which includes likes, rewards, and also the algorithm. So there is an artificial intelligence which feeds us with content that is of interest, but also because we may lose the curiosity, the interest to that content, very quickly, within a few days, provides us with very extreme content. The content online is often very harmful. So there is an increased sexist, misogynistic, and homophobic content in the online world. And again, in Australia, as you know, one woman is killed every 8 days. what is very concerning is that 2 in 3 young men, ages 16 to 25, they engage with online influencers who paint a very derogatory, if you like, the way that they talk about women, about girls, is very derogatory through insults, through slurs, but also encourage sexual violence. These are some of social media platforms and gaming platforms. You can recognize here Discord, TikTok, Instagram, Steam, and X. Two of them are not in the social media ban, Discord and Steam. These platforms are used by people to play games, but to watch also people playing games, to access online content. And some of the content is used to promote dehumanizing, sexist, and misogynistic content. One of these platforms, Discord, is very well known because children have been groomed online and have been kidnapped.
And Daniela, sorry to interrupt. We can't see your slides.
You can't see?
No.
From when you couldn't see? Because, can you see?
No. No. I'm wondering if people are comfortable if we share your slides afterwards.
Yes, please,
Because
yes.
we understand we totally understand what you're saying.
Yeah, I didn't know you were not able to. Yeah,
Yeah.
absolutely.
I was a bit reluctant to interrupt, but
No,
I thought
no,
it's
it
better to
would
let
have
you
been
know.
very useful. Yeah, please.
Yeah. And Quentin, while we're here, is it okay if we share yours as well?
Sure.
Fantastic. Okay. Sorry,
So,
Danielle, for
can you
interrupting.
share my slides? So we see from where you could not see them.
We haven't been able to see them.
Okay, no, that I'm sorry, because I can see them, so I thought you were, and I was going ahead.
Yeah. But that's fine. We totally
You
we
were
understand
able,
what you're saying.
I can go back on the data from the clinic, which I think are important. Rosa, are you able to go on the clinic data, the gaming clinic data?
Just give me one moment.
Okay.
Can you give me the slide number, Daniela?
So it's number, I think 10, gaming clinic data.
Yeah.
Yeah.
Just one moment.
We are all looking at you.
Nearly there.
No pressure.
Yeah. Just making sure you get the right view this time, that's all.
Okay. So we're saying gaming clinic data.
Are you getting that?
Beautiful.
Yep.
Okay, do you want to go? If you go to number 10, which I think is important, scroll down. Okay, here. Perfect. So we saw 374 patients we have seen. Next slide. Majority are males. Next slides. You can see that most of them are teenagers, age cohort 15 to 19, followed by the age cohort 10 to 14. However, we have an increased number of referrals for the age cohort 5 to 9. And I was telling you that the youngest of our patients is 5 years old. Next slide, please. So what is very concerning is the education. Most of our patients refuse to go to school. They are not in education. Next slide. Similar is for employment. Most of them are unemployed. And then the last of this, the next one. Yeah. And the majority of them are not in a relationship. Next slide, please. The next one. So as you know, Australia, unfortunately, the phenomenon of bullying in school is very high and ranks the second highest amongst English-speaking countries for bullying in school. Next slide. You can see that the problem of school refusal, which unfortunately is not recorded as a school refusal, but only as a school non-attendance, is quite relevant. These are data from Western Australia, from the annual report. Only 58.1% have regular attendance. Next slide. Next slide. So why we are so attracted to gaming, to social media, is because of their design. The way that they are designed is to keep us engaged and for us to spend as much time as possible and as much money as possible. Next slide. So gaming and social media platforms, they are carriers often of harmful content, which can be sexist content, misogynistic content, and homophobic content. Next slide. As you know, one woman is killed every 8 days. What is also relevant is that 2 in 3 young men, aged 16 to 25, they engage with online influencers. And what we see in the clinic is these teenagers who are very much isolated at home and communicate online, often with strangers. Next slide. So both gaming platforms and social media platforms, they can promote hostile and dehumanizing, sexist and misogynistic content. Andrew was mentioning about lack of regulation. The same is for harmful content and for addictive design. What these platforms have is insufficient regulation of the content which is online and also of the design, the addictive design. Next slide. A platform like Discord, which is used by gamers and these platforms where people connect online, also has been the carrier of predators who have kidnapped, groomed, and sexually assaulted children. Next slide. So what happens to our brain when we are exposed to prolonged online use? Our brain is affected exactly as if we were abusing of alcohol and using drugs. The same areas of the brain are affected, and these are the frontal lobe and the white matter integrity is compromised. This means that people lose that ability to do a critical thinking, to prioritize, to regulate their emotions, and become very much aggressive, very much dysregulated. Next slide. You have heard of this recent tragic event of this shooter who in Canada killed other children and teachers. Here you can see some red flags. So the ability to access extremist content online, mental health issues, playing video games, the family instability, but also was able to simulate an online shooting game at a crowd in a mall on Roblox. So this game was developed and was able to circulate. Next slide. This is the game where you can see this character shooting people in a mall. So again, this is a clear indication how there is no really regulation on what there is online. So anyone can develop a game like this and put this online. Next slide. Something that the clinic is now doing, we are going beyond just treating the addiction. We are linking patients to volunteering organizations and to charities which offer workplace-based training. Next slide. This is one of our patients who was unemployed for 2 years. Most recently, through the clinic, has started a volunteering work and feels a sense of a purpose and has a structure. Next slide. Some of our recent developments, we have started screening during the perinatal period. So we screen pregnant women, women who have given birth, patients of Fiona Stanley Hospital, and we provide education to them and to their partners about online harms. This is because we are very passionate about the importance of prevention and early intervention. Next slide. Our vision is to have a hub and spoke model where the hub can be in the hospital, but the spoke is made of community clinics closer to where people live and work. Next slide. So online harm is a public health crisis and we need public health interventions. These should include raising awareness, education of GPs, education of teachers, education of health professionals. We need screening in schools to be able to screen children who can be at risk of developing online addiction. We need the legislation, so we need the regulation of harmful content and addictive design, and this can be done only through government. We also need the funding for research, and we need specialist services for people who have developed online addiction. Once again, our clinic is the first clinic, but it's also the only clinic for gaming disorder and social media addiction in Australia. Every week I receive requests from other states in Australia asking for help, and unfortunately, we cannot deliver that help. Thank you very much. And sorry about the slides and the sharing.
Thank you, Daniela. That was huge. That was a huge lot of information and really important information. Thank you so much. People, if you've got questions, put them in the chat and we'll get to them. I'm now going to hand over to Rose Newby Freeman. She's our Senior Policy and Projects Officer, and she's going to present the findings of our study, A Path Forward Reducing Gambling Harm in WA, a scoping study. I will note this was made possible by funding from Healthway, and I'd like to thank the steering committee that helped guide us through this process. We really appreciated their input. Over to you, Rose.
Thank you. Good morning, everyone, and thank you so much for choosing to spend your precious time with us this morning as we explore this important topic and share some important findings from our project. Gambling represents a growing public health concern in WA, with millions of dollars lost each year and profound impacts on individuals, families and communities. Despite mounting evidence of financial hardship, mental health challenges and social dislocation linked to gambling, government responses have largely been limited to addressing issues in the Perth casino, leaving other important areas of gambling-related harm in WA unaddressed. The scoping study's purpose was to explore priorities and approaches to reducing gambling harm in WA. The goal was not to offer a fixed plan, but to explore some possible areas where meaningful change could be achieved, as well as to understand the gaps and opportunities for change in WA. As Rachel mentioned, the project came out of the WA Peaks Forum discussion, which formed a subcommittee, and then they became the steering committee for this project. And I too would like to acknowledge their work in this report and its findings, as well as Healthway, who made the project possible. The focus of the report was to look at the current state of harm reduction and prevention, look at the opportunities for change, and to begin the groundwork for a coordinated approach to gambling advocacy in WA. This morning, we have published 2 reports on the WACOS website. One is the full scoping study and the other is a summary and recommendations paper. I encourage you to take a look at them. I don't have time to share all of the work today, so I want to focus on some key findings and recommendations that I hope you'll all find relevant and interesting to some of the work that you do. Some of the key issues for WA and the gaps that we identified was a general belief amongst government that there was not much that there was to do on the issue around gambling harm, as because WA has a restriction on elite gaming machines, otherwise known as pokies, around the country, and other major problems were related to online gambling, which falls under federal jurisdiction. Rob Meacham, who was one of the authors of the report, undertook consultations with community services and various departments and agencies, found that the Department of Health, Department of Communities and the Mental Health Commission all shared that reducing and addressing gambling-related harm didn't sit within their mandates, and that there was limited data collection around the issue, in part due to this not having responsibility for it. Insufficient dedicated resources are allocated to gambling harm, limiting the ability of services to deliver effective responses. Although many services and organisations support individuals affected by gambling harm, they typically do so in the context of other presenting issues such as mental health, housing or financial stress. The independent advisory body that was recommended by the Perth Casino Royal Commission has not yet been set up. The makeup of the current committee that oversees gambling harm, which is called the Problem Gambling Support Services Committee, currently includes industry representatives and does not have any public health, community services or people with lived experience on it, severely limiting its views and understandings. At a national level, the Australian government has not yet implemented the recommendations of the Murphy report. This inquiry into the online gambling and its impacts of those experiencing gambling harm. In order to address and reduce gambling harm in WA, we need to build a more coordinated, inclusive and evidence-based approach. We have a range of recommendations that we think seeks to do this. I won't cover all the recommendations, but some of them that I wanted to bring to your attention. It is clear that we need to build a coordinated approach within community services and health sectors to develop a coordinated and sustained response to gambling-related harm in WA. Establishing formal networks or working groups will help facilitate this collaboration, enabling organisations to co-design approaches, pool resources and amplify their collective voice. Such efforts could also support the development of shared tools, training and evidence-gathering practices that can build sector-wide capacity. Importantly, this collaborative momentum can lay the groundwork for more effective engagement with government and other stakeholders. A key to achieve this is by establishing a coordinated advocacy mechanism in WA. This mechanism could take a number of forms, and the steering committee wanted to present some options, but by no means is it limited to this. We could commission an existing WA organisation to do this work, establish a new organisation within WA, or explore collaborative national partnership models to achieve this. It is clear that some type of coordinating mechanism is required in order to address and reduce gambling-related harm in WA. We have also identified some priority areas in WA and nationally that we would feel would be a strong place to start to engineer change in this space. It is clear that we need to increase public and government awareness of gambling-related harm in Western Australia. We need a cross-sector commitment to address gambling-related harm, encouraging coordinated action across key social policy sectors, not limited to, but including mental health, alcohol and other drugs, housing and homelessness, financial counselling, Aboriginal health, and family and domestic violence. This includes integrating gambling harm into relevant strategies, frameworks, and action plans that already exist to ensure a holistic and inclusive approach to prevention and support. We need funding for service coordination and targeted workforce training to address gambling-related harm. Dedicated funding is needed to support the coordination of these services. This will strengthen the capacity of frontline workers and organisations to identify, respond and prevent gambling-related harm through integrated and informed approaches. Really importantly, we need independent decision-making and inclusive representation in gambling harm policy and governance. The gambling industry should not be involved in decision-making related to the prevention and reduction of gambling-related harm. Relevant governance and advisory bodies should include diverse community representation, such as public health experts, service providers, researchers, young people, and individuals with lived experience to ensure policy and decisions are transparent, evidence-informed, and aligned with community needs. We also have some recommendations related with a national focus. Most important to this, as Quentin shared, is the full implementation of the Murphy Report's recommendations, particularly those that include phasing out advertising, developing a comprehensive national strategy, establishing a national register, and delivering research-based public education. We also need to support the development and implementation of research-informed warning messages across all forms of gambling product promotion, and support strengthened and more transparent regulation of online wagering services based in the Northern Territory. This project highlights the urgent need for WA to adopt a comprehensive, coordinated, and well-resourced public health response to gambling-related harm. Despite growing unequivocal evidence of widespread impacts of gambling, ranging from financial hardships to mental health issues to social disruption, current responses remain limited, with a narrow focus on casino regulation and insufficient attention to emerging risks such as online gambling. Without strategic direction, adequate resources, or a clear mandate, the health and community service sector are left to address gambling harm incidentally rather than through a coordinated, planned, or evidence-informed interventions. The recommendations set out a pathway for meaningful change. They call for WA to support overdue national action, including the full implementation of the Murphy Report reforms. At a state level, the establishment of a dedicated advocacy mechanism to lead gambling harm reduction in WA is essential in driving coordination, accountability, and strategic planning. Equally critical, a cross-sector collaboration, the inclusion of public health experts and people with lived experience in decision-making. Advancing these priorities will position Western Australia to reduce gambling-related harm in a meaningful, equitable, and sustainable way. By strengthening regulation, investing in prevention and support, and ensuring that community voices guide policy and governance, we will reduce gambling-related harm and protect individuals, families, and the community. Thanks, Rach.
Thank you, Rose. As you can see, it's a comprehensive report, and I urge everybody to go and have a look at it online. What we will do, if it's okay with the presenters, is we will share both sets of slides and links to the reports after we've concluded the webinar. Now I'll go over to questions, and I have a couple already in the chat, and then we'll take some from the floor. The first question is to Quentin. Do you think the public fully understands the scale of gambling harm, or is there still a gap in awareness?
It's hard to answer that question definitively, but I would say, obviously, no, the public doesn't fully understand it. You know, the commercial media is really tied into the gambling industry. When you think about the TV companies, the newspapers, are fundamentally owned by corporations that benefit from gambling. And so I think that's a limiting factor in informing the public. Outlets like the ABC, of course, do a pretty sterling job. And, you know, I mentioned The Guardian as well as among the outlets that are promoting it. But so there's structural impediments to the way in which governments understand this, but also there's been no real promotion of the need for gambling reform by the major political parties. Because as I try to outline in the course, for 20 years they felt intimidated from taking on gambling reform because of the power of the industry, and also because they are partners in it through government revenue. So there's no real incentive for the political parties to go out there and champion the issue. And so we've got these structural impediments to the public really understanding the full nature of this significant social problem around the industrialised scale of gambling in Australia. Now, the Murphy inquiry, I think, was very important in spreading public awareness because it got a lot of publicity. And, you know, there are very, very important voices in this. Obviously, WACOS is one in Western Australia now with your advocacy in this space, but also, importantly, people like Tim Costello has been advocating for gambling reform for 20 years. So there are important voices in it, but I think there is a power imbalance between the vested interests of the players and public awareness.
Okay. I'm going to ask a supplementary. From the report, it's very obvious that Western Australia, people think we don't have such a problem over here, but the scoping study shows that, in fact, we do. Does that come as a surprise to you? Or is...
Because, you know, I used to live in Western Australia, and part of the Western Australian political culture was pride that Western Australia, you know, for 30 years hadn't followed those greedy eastern states that got into bed with the gambling industry. The John Tompkin government in the early 70s held an inquiry and said the clubs in New South Wales were causing a social problem. Let's not go down that road. And they didn't, and it became an article of faith on both sides of Western Australian politics. In ways it's, you know, on the surface, quite hard to understand because the industry is so powerful. You've got Packer in Burswood and so on and so forth. But because it had bipartisan support, this, I think, was the critical thing. It had bipartisan support. So I think that there is there's an important sense in which Western Australia has to continue to take pride in banning poker machines from the community, because problem gambling and the social ills that come out of it is really sort of in two main buckets. One's poker machines and the other's online gambling. Now, there are others, of course, but they're the two main buckets where the problems come from. And so I would argue that the problems in Western Australia would be worse if that decision to ban poker machines other than in Burswood Casino had at any stage been rescinded.
Yeah. Oh, agree. It's the concern that we're not recognising, I think, where the harm is, that there is harm and where it's coming from.
In saying that though, I wouldn't seek to diminish at all that Western Australia has very similar problems around online gambling and, the socialisation of children into gambling through TV advertising and all the rest of it. They are very significant problems, and there'll be a Western Australian dimension as to how those problems have impacted on the community.
Thank you. Daniela, the next question is for you. And the question is, are we treating the harm but not challenging the system causing it?
It's a fantastic question. And what we are treating is for India and a very limited cohort of people who, come to us. And when they come to us, they are already they have been harmed for a number of years. So they're very complex already, they're quite de-skilled. So yes, it's a system, but it's challenging the system and challenging the interest of the system in the end, which is also what... So we should do a lot, but to do that, we should really challenge the gaming industry, which of course is very rising in Australia. So there is a support for the gaming industry. So we should challenge that. We should challenge the harmful content of the games, the addictive design. We should challenge that, there is a need for education in schools, if you like, Rachel. We should, support the teachers to identify the online harm, the online addiction. And I think also we should, in my view, we should provide education, upskill GPs, but we should also look through the school curriculum so that it becomes embedded in the school curriculum, exactly like it's embedded, the harm from alcohol, from drugs, but also the gaming, the social media, and it should be through the curriculum. So I think so far what we provide is interventions which, if you like, are often fragmented and not coordinated, and they are more based on the goodwill, but not on political support and not on adequate funding.
Okay, thank you. The next question I'm going to basically address to all three of you, and that is, to what extent is it useful to consider gambling or gaming addiction as a gendered issue?
It's not really, I can talk about gaming. It is true that we see more males than females, but in the reality, gaming and social media platforms are so interconnected. So all these boys who play games also use social media platforms, gaming platforms, to connect with each other, to watch videos of other people who game. So it's not just an issue of boys. And now we see girls who play video games. So I think they are very much, I wouldn't say it's gender issue. What I would say, to be honest, is that we don't really know the numbers. This is what I would say. Until we do a proper, screening, and we are able to identify the numbers, then we can talk why more boys on more girls.
Okay.
You said something there?
Yep.
Look, in terms of the gambling industry itself, since the advent of online in the early 2000s, they heavily targeted young men because they worked out, obviously, that young men love to socialise around sport, and they're taken over the big sporting codes. So if you look at all the advertising, or most of the advertising until quite recently, it heavily targeted young men because of their interest in sport and because young men typically overestimate their ability to understand odds. In other words, they lose a lot. Now, that changed a bit in recent years, and the gambling industry realised that young women were an untapped market. And so they developed specific products for young women. In other words, as a generalisation, young women aren't as interested as young men in betting on sports, but they'll bet on other things, on music competitions or Dancing with the Stars competitions, those sorts of things. And so there is, I think, a gendered approach in the way in which the gambling industries develop their business models. I mean, they know how to extract profits from this. But what we're seeing is the industry targeting now both young men and young women. And of course, we don't know yet the full impact of, how long is it? Nearly 20 years of mass advertising. And the way mass advertising through sport will affect the future cohorts of gamblers in a gendered way. Just don't know the answer to that yet. We need, more data. We need more time to work out how this is all being played out. But there's just been this huge social experiment in Australia of exposing young children to mass advertising of gambling in ways that not too subtly teach them how to gamble. I mean, that's the point of a lot of these ads, is not only to normalise gambling, but to instruct. Now, I don't know, the results will be out in 10 years' time.
Thank you.
I would just add to that, agree with everything that's been said. And while men gamble at a higher rate, if we're talking about gambling harm is not only to the gambler, it is also to their families, partners, and it can be friends as well. So I think in terms of it being a gendered issue, if we're talking about gambling harm, it's beyond just the gamblers, and I think affects not just adults as well, affects children and everyone.
Thank you. Louise, you had a question regarding simulating racing and selling off the TAB.
Thank you. Yeah. This is a bit of a comment because it hasn't happened yet, but we don't, as we all know, the casino is where, the poker machines and everything are held here in WA. Recently, in the last few years, the West Australian government has tried to sell our TABs, which are often inside hotels and pubs in the special region of WA, and they changed the legislation so it could include simulated racing. And that simulated racing is it's a cartoon basically of, greyhounds running down a track. And we made jokes about we could have a simulated racing of politicians racing to the finishing line. We totally opposed it, but it didn't get much public attention. Now, they didn't get any offers on the sale of the TAB. And even in their advertisement when they were advertising the sale of the TAB, they were really pushing for, there'll be new products you'll be able to introduce. I just wanted to hear comments from the three panellists, what they thought about this and how important it is, or do they think it's important to keep simulated racing out of our TABs and our pubs?
Okay, if I could start on that, I think the selling off of the TABs around the country has occurred over the last, I don't know, 20 years maybe. Each state's done it differently at different times. The interesting thing about when governments own TABs, there was some recognition built into the regulation of them that understood the need not to make the TAB too attractive. So if you think about your memories of the TAB from the 70s, and I certainly have these clearly in mind, there was nowhere to sit. They didn't serve food. They didn't serve alcohol. It was basically, it was basically working class blokes standing around betting. And I mean, and they were often pretty grotty places. I mean, they weren't attractive. And so when they sold them off, they became commercial enterprises. And so the business model then became grow the market. And so you had TABs becoming essentially part of the industrialisation of gambling in this country. So to that extent, I think it's been a retrograde step. I mean, if you're going to commercialise them, then you need to regulate them. And we didn't do that. The second thing about simulated racing out of hotels, just a disaster. The local hotels, become a multi-dimensional gambling venue. And so you get the footy there for some people, you go bet on the footy. Then on another screen, you'll have greyhound races from all around the country, bet on them, et cetera, et cetera. One of the things I would say about greyhound racing is that, there are these, 50 odd tracks around the country. Greyhound racing is an inherently cruel industry. It ought to be banned. It's been banned around the world. Its epicentre remains in Australia. Some states have announced plans to phase it out, but it's a very powerful inducement to gambling generally, because greyhound race lasts 40, 50 seconds. They telecast them from all over the country. It's bang, 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 bang. And it's often seen by the industry as a gateway into other forms of gambling because it's so fast and furious. So again, no regulations about the broadcasting of sports into hotels that are now associated intimately with gambling. I mean, it's no wonder that the problems have escalated.
And my real fear too was the introduction of a new product. So whilst we don't have pokie machines in our hotels here in WA, the simulated racing it would be another way of introducing that. And that was how the WA government was advertising it, the opportunity to introduce new products. They didn't sell it, thank you, but they still have the opportunity when they go to sell it again. And there was very little public outcry about this because West Australians traditionally are very happy we don't have pokie machines in our hotels. There's lots of other risks. Gambling is a huge problem, but we don't have that issue.
Yeah.
We have plenty of others.
No, I agree, and I agree with you too that the simulation of racing in hotels is a new product. I don't know how long I do know how long it's been there, but I don't know off the top of my head. But that's run by Tabcorp often, big multinational gambling industry. Again, no government regulation about whether this should have occurred, no government thinking about the social consequences of it. It's just been foisted onto the community. So I think it's one of the areas. And it doesn't necessarily come up in the Peter Murphy inquiry because it's about hotels, not necessarily about online, but the whole thing's a fuse now. So hotels are the physical venue and online gambling is the mechanism and TV is the vehicle. And it just goes around in this circular motion to increase the normalisation, the accessibility of gambling.
Okay. I'm going to try and squeeze in another question. And referring specifically to Losing Sound, a project to make pokies less addictive, the question is, will these, in inverted commas, better pokies actually work to reduce gambling harm if it were to be implemented on all pokies versus restricting the number of pokies?
Who's going to answer? Do you want me to answer that one?
Yep.
Or Danielle might have something to say about it.
Yeah. We'll go to both of you. Or and
Okay.
Rose, if you've got a comment as well.
The history of this is the most rapacious poker machines in the world are built in Australia for both the Australian and overseas market. They're called high-intensity poker machines. They're designed by psychologists to be highly addictive, but also government allows high bars on the amount that can be bet on these poker machines. Now, Victoria's made some changes to this, so that's noteworthy. But if you look at the history of this, we have had in Australia the worst possible policy framework for gambling addiction pretty much in the world. That is, we've mass released poker machines into the community. Look, they're in surf lifesaving clubs. I drove to Cooktown a couple of years ago, one of the most remote towns in the country. And I get up to Cooktown and there's a little pokies den, in town. I mean, it's just insidious. And so poker machines have been allowed to infiltrate into the community and be highly addictive and allow large losses. I mean, this is just a trifecta of disaster. And no serious, really national policy framework to rein this in.
Thank you. Daniela, did you have anything to add?
I think what I would like to add is more about gambling into games, if you like. So where children are encouraged to spend money on some rewards, which in the end are unpredictable. So you can get something which is quite good for your character to make the character more powerful, or you can get something which is very trivial. So it's again, like Andrew was saying, children are now encouraged at a very young age through different addictive designs. So I think this is quite relevant for us. And again, the regulation is limited.
Thank you. Then I'll make this the final question because I did promise that we would finish on time. Is there any early intervention programs in place at schools?
I'll leave that to Daniela.
Okay.
What there is in schools is, some schools, particularly, I guess, private schools, are able to have speakers. People go there and talk about online harm, and this is, of course, very useful. But I don't think this is in every school, and certainly there is no screening for gaming disorder, social media addiction in schools. Again, we are very behind countries like Korea, where the government funds programs of screening for online addiction in schools, and where children then are provided with brief interventions. So this is the early intervention. This is the prevention. We need to act very early. And we don't have that. So I'm a strong advocate for prevention and early intervention in education, starting from schools.
Thank you. Thank you so much for today. Really appreciate your time, the work you're doing, and helping to raise the profile of this issue and the importance to address it here in Western Australia. Can you join me? Thank you. People have already started their clapping. Their online clapping? Can you join me in thanking our speakers today? We really appreciate your time and commitment and the work that you do. We will circulate the slides and the links to the reports, and watch this space because we do want to keep working on this issue as a sector. Thank you very much, everybody.
Thank you.
Bye.
Well done.